If you're skeptical about chiropractic care, that's actually a good thing. Healthy skepticism usually means you're thoughtful about your health, you ask questions, you don't want to waste time or money, and that if something doesn't make sense, you're not going to commit to it. I'm Dr. Norris Golberg from Koru Chiropractic here in Louisville. Today I want to talk to you about skepticism and why asking the right questions can actually help you find better care. So when I got to chiropractic college, I was a little bit naive. I didn't have a lot of skepticism. I just thought, wow, this is amazing. After I got my first adjustment, turned my lights on, I felt great, right? But as I started studying the science and art of chiropractic, I realized that there was a lot of gray area. There was a lot of inconsistencies. And simply getting, popped or cracked, while it may feel good, it may alleviate some pain, oftentimes the results are very temporary. And what that inspired me to do as a skeptic was to just find the types of chiropractic care that really delivered the best long-term solution for people's health problems, right? Not quick fixes, but actual longevity and solutions that work and last, okay? So we really meet two types of patients in our office. The first one is the one who comes in, they already know chiropractic works, they know it's gonna help them, they've tried it before, they don't ask a lot of questions. But the second is a group who walks in a little bit more cautiously. They like to say things like, I'm curious, but I'm not quite sure. Tried chiropractic once before, but it didn't maybe work. Or maybe even like, my spouse told me I had to come in, but I don't think this is gonna help. And honestly, that second group of people, although at first they seem like they may be hard to work with, they usually get great results in our practice. I believe the reason is because those people, they're actually paying attention. They're kind of wary, they're alert, they're thinking critically about what's happening here in the office. And they want to understand what's actually happening to their body, why they're experiencing these problems, and how is chiropractic actually going to help fix it. So the problem isn't skepticism, the problem is when people stop asking questions altogether. See, with healthcare, if you just hand over your health to a practitioner and you're not thinking through the problem with them, that's when oftentimes you can become misguided or just not get the results that you're looking for. So healthcare really works best when patients understand the logic behind what's happening, and when something doesn't make sense, it's reasonable to ask why. If you're dealing with headaches, dizziness, neck pain or back pain, or other posture issues, you deserve clear explanations, because it's not as simple as just stretching it out or doing a simple exercise or getting popped and cracked, right? These vague answers, the hype, that's not what we do here. It's just simple reason and logic. So here are a few questions that I think every patient should ask any provider. First is exactly what are you measuring? If care is based purely on symptoms, the treatment tends to follow pain rather than pattern. Second, how specific is the treatment? Precision matters. And the spine and nervous system are complex structures, and small differences in alignment can actually add up to big changes in how the body adapts. Third, is the goal relief or correction? Relief is important. We want all of our patients to feel better, but correction aims to change the pattern that caused the problem in the first place. And finally, is there a clear plan of action? Good care should have a logical progression, evaluation, correction, and then stabilization. At Koru, we welcome skeptical patients because our approach is built around measurement and explanation. That's what makes me happy. I want to see the results for myself, and of course, I attract patients who want to see the results for themselves. So we evaluate posture, we analyze spinal alignment with precise imaging, and we assess neurological stress patterns. Then we explain what we see and why it matters and how it's related to you and your symptoms. The care is gentle, specific, and it's designed to help the system and spine get into better alignment and function at a better rate. From there, the care is gentle, it's specific, and it's designed to help the nervous system adapt to this healthier, more natural alignment. There's no hype, there's no pressure, just clarity of exactly where your problem is and how we're planning to fix it. As I've mentioned, many chiropractors, they actually don't want a skeptic. They want someone who's gonna get in on the hype, they're gonna commit, they're not gonna ask a lot of questions, and that's fine. There's a chiropractor out there for you, and that type of person can come see me as well. But if you're a skeptic, trying to understand the why behind your spine-related health problems, then we may be a great fit for each other. Because I like to go deep, I like to be thorough, and I like to give you very precise solutions to your health-related problems. So if you've been curious about chiropractic and you still have questions, that's completely reasonable. I haven't been able to answer all of them today. The goal of the consultation isn't to convince you of anything. It's just simply to help you understand what's happening in your body so we can make an informed decision about how to move forward and help you best with your spine-related health problems. And if that sounds helpful, then I would be happy to talk. Thanks for watching the video, and we'll see you in the next one.